Well, hello and welcome to RAD 320, Advanced Patient Care for Medical Imaging. My name is Chris Gibbons. I'm going to be your instructor for this semester. If you don't know who I am, I'm also the chair of the Bachelor of Science in Medical Imaging program. What I'd like to do in this video is do a kind of a quick walkthrough of the syllabus, talking a little bit about each one of the assignments that you'll have due throughout this course. Now, this particular course, kind of as a general overview, is a little unique in that the course is designed in 3 different units. Now, you're probably all are aware of the module format. There are 8 modules per course typically. Each module, I should say, equates to about a week's worth of work. But the way this course is designed is that we have 3 topics, kind of these broader topics within this course. So I thought it made sense to segment the course into 3 individual units as we go through it. So the first unit that we're going to have, and it will be made of 3 different modules, and each unit will have 2 to 3 modules in it, so 2 to 3 weeks worth of work. But the first unit will be pharmacology. A very important topic. I think it's probably the most dangerous thing that we deal with as medical imaging professionals. That and, of course, radiation dose. But the possibilities of things going wrong quickly with a pharmacological issue are much more acute. So very important topic. So we're going to go through pharmacology in our first unit. The second unit, we're going to be talking about legal and ethical issues as it relates to patient care and your profession. So I think you're going to get some interesting knowledge there, maybe some things you haven't been exposed to. And then the last unit, we're going to delve more into very specific modality patient care issues, and we're going to hit on the 2 big modalities of CT and MRI. Not that the other modalities aren't important, but when you look at the volume of patients just in CT alone, kind of eclipses all of the other ones. So we do have to pick kind of where we want to put our emphasis at, and we're going to put that into CT and MRI as well. But you know, the other units, of course, apply to a much broader spectrum of patient care interactions through all modalities. So that's how this course, kind of an overview, how it's designed with these 3 different units, each unit made up of the traditional modules that you are aware of. Some other things about this course that are a little different is we won't have a midterm or final, so I'm sure you're happy about that. It'll be much more of a kind of a progressive thing as you go through, more, I would say, project-based learning versus assessment-based learning where you have to do a test. You're going to be doing actually little mini projects. But I tell you what, let's go into the syllabus. Hopefully you've printed it out. If not, you may want to pause the video, print that syllabus out, and then follow along with me as we go through it, and we'll kind of highlight some of the important areas of the syllabus. Okay, here you go. On the syllabus, we tried to make all of our syllabi have a kind of a format that's the same, so you don't have to struggle for finding the information, especially in the medical imaging program. We do try to keep everything consistent. So hopefully this format looks similar to what you've seen in your other courses. Again, the big thing here, technological help. If you ever have a problem with D2L and you know, at any time of the day, you can call the 1-877 number. Or you can use the email address there to Desire to Learn. Basically, where this is going to come a crisis is where you're taking, not in this course because we don't have a midterm or final, but if you're ever in a midterm or final and you're doing it on D2L and something happens, what do? Well, the first thing you do is you call Desire to Learn, and that generates kind of an incident report. We call it a ticket, but it generates a log, if you will, that something happened to you. Now, they might be able to rectify it right then and there. Most likely, they will not be able to fully rectify it. A lot of times they'll have to get instructor permission to allow a test to go back in, but that's not important. The most important thing is you've logged the incident with Desire to Learn. So if I were you, I would write that telephone number down and put it on a little sticker or sticky and stick it on your laptop. So if you ever have a problem, anytime you call that number and get that incident report, that ticket generated. So when the instructor has to go back and see if, in fact, what happened, they have this, and then they should be able to rectify the situation, maybe reopen the test for you or whatnot. So there's my little knowledge on the technological help. You probably won't need it for this particular course, but keep that in mind for your other courses. Let's see. Well, we've got the normal, the virtual office. Most of you should be familiar with that. And as always with virtual office, those are for general course questions. Feel free, if you see a question in the virtual office posed by another student and you know the answer, it's perfectly acceptable for you to answer that. So feel free to go ahead and do that. I do go into the virtual office on a consistent basis. You can always expect a response from me within 24 to 48 hours. If you have a personal issue, of course, don't put that in virtual office. Contact me directly through email or just giving me a call. The course description, again, we've kind of gone over that, and let's move on to the second page. Sorry about that. We'll go move on to the second page. We're going to have various learning activities, I guess, throughout this course. And it's kind of the normal thing that you have already probably seen in your other courses. You're going to have video lectures sometimes. You might have some video, other kinds of supplements. You'll have textbook reading. We do have 2 textbooks for this course. There might be other comprehension exercises as you go through this. The most important thing to know, though, is that there are no synchronous activities required for this course. So that means we're not going to have any particular time where you have to sign on your laptop and where we all gather together, like in a chat room or in a web streaming collaborative event. We won't have any of those. They'll all be asynchronous activities, which are almost nearly all of our activities at Mercy College are asynchronous. Textbooks, hopefully you have them. If you don't, let me know immediately. Especially your first one, the Pharmacology and Drug Administration for Imaging Technologists. Technological requirements, that's kind of the standard fare. I think most of you are probably good with that. We will have no video presentations required from you this time. So for those of you that were in my last class and did MoveNote presentations, or for those of you that have done maybe VoiceThread presentations, we will not have, there will be none of those in this particular course. Okay. Course objectives. Whoops, sorry about that. Course objectives. Again, we've pretty much hit on it by describing the 3 units that we're going to be going through, but we're going to go through legal and ethical issues. Going to hit on methods of infection control, vital signs. Going to hit on that again, which you probably have already been exposed to that in associate programs or even maybe at work. We're going to talk about different types of communication, patient communication, verbal, nonverbal, etc. We're going to talk about charting and documentation, identifying patient care and safety concerns for CT and MRI as well. So we'll be covering all those course objectives as we work through this course basically for the rest of the year. So online participation. Whoop, sorry about that. Let's see if I can scroll up here. Okay, sorry about that. Online participation. Again, just stay active in the course. Make sure that you are following all the response guidelines for threaded discussions. So, again, kind of the standard fare for online participation. Where people fail with online participation is if we see you popping in the course Sunday at 7 o'clock, and finishing everything in the discussion threads. that's not really necessarily how we want it to work. What we want is, postings to happen. You're going to make a main post to a thread discussion, for example, on Thursday. We want everybody to have a chance to read those, and then you'll have a few days to respond to those. So we want kind of a give and take between the students, so you guys can see your posts and do that. Just not jump in on Sunday night and drop your responses, and no one really has a chance to even read your original thoughts or your responses before the module closes. So that is our goal here. Okay, let's move on. Grading policy outlined here, and we're going to go over each one of those assignments here in just a second. And the grading scale, let's just scroll up here, is a standard scale here. We try to do everything out of 1,000 points, so it makes it easy for you to calculate your percentage at any one moment to know where you stand. The big thing about Mercy College, just to emphasize this, probably to death here that I've mentioned this, but a 92.9 is a B. So you want to make sure that you're in that 93 or higher zone if your goal is A quality work. So keep that in mind. A 92, 91 maybe was an A minus at a previous institution. We do not do minus plus grades here, so you have to get the 93 to get the A. So be aware of that. Okay, let's talk about these assignments. Keep in mind that I'll put my little asterisk in here, my little caveat, that we can change this on the fly if we see that maybe something's a little too confusing, or maybe it's too much work or too little work. Things can be changed. I can change the syllabus at any time, but don't worry. I'm going to give you guys plenty of heads up before we change anything. But the plan is we're going to maintain what these assignments are throughout the course. So the first thing that you'll have is an opening case scenario. Again, look on here. You do have a minimum word count required, and you're going to have a minimum word count on responses. And we want those to be meaningful responses. Look in your syllabus. Towards the back, there are some guidelines for what a discussion response should look like. Now, those guidelines are pretty thorough. I'm not going to be that thorough, but I am going to look for at least some meaningful content that you are adding something to that particular dialogue. So, be careful there and make sure you meet the word count requirement. What I would recommend to count your words is you compose let's say your main post, you compose it in Microsoft Word. Word has a little word counter on there, so you know exactly how many words you're at. And then you do a copy paste into the discussion forum. So it's very easy. Nice little spell checker on there. You can take everything, make it look nice and pretty in Word, and then paste it into the discussion forum. And that's how I'll grade yours as well. So I'm not going to sit there and count to 100, to count to 200. What I'll do is I'll copy your posting, your main posting, and drop it into Word and let Word count it for me. So be aware. Make sure you meet that word requirement for both your main post and then your classmate responses that you do. So we got 200 for the first one and 50 words for the second. Also note, just for the opening case scenario, because this course starts sort of on a weird date. We start on a Wednesday because of the fall break. And I hope all of you had a wonderful fall break. I know I did. But we kind of start with a little bit of a compressed week. And I'm going to allow you some, it's only fair that we extend that due date out on some of these first week assignments. So your first week assignments will not be due until Tuesday of next week. So keep that in mind as well. But your opening case scenario, your responses to, I think, what is a very dramatic scenario, and it's the kind that makes my stomach just, cringe. Because it's something it does happen. So do look at that. Make sure that opening case scenario is done by Friday. by midnight, and then you do your classmate responses by Tuesday. So again, your main answer by Friday, midnight, and then your classmate responses, you got until Tuesday of next week to get those in. Mid-course conferences, also formerly known as our one-on-ones, we'll be doing those again. I'm a big fan of it. I hope you don't feel that it's a burden. Again, I just want to touch base with all of you as far as a phone call and making sure that you have no questions, concerns, anything I can help you with in the middle part of the course. So if there is something wrong, we can fix it. And we can also talk about the program as well, since I'm the chair, if you have any questions that way. So it's a great way for us to touch base. Please allow about 5 to 15 minutes for that conversation. We will be using the Doodle Scheduler once again. For those of you that had me last semester, our last 8 weeks, we'll be doing the Doodle Scheduler. And I know that Quentin, one of our other instructors, uses a Doodle as well. So hopefully the rest of you are familiar with the Doodle Scheduler, but it's pretty easy. And we'll be doing that to schedule our one-on-ones. Weekly learning activities. Each week you're going to have, it's sort of like workbook activity where you might have some kind of, I guess, puzzles where you'll use content that you've learned for that particular week. There might be short little essay answers. There could be kind of like fill-in-the-blank answers. We're going to be doing some other, well, that's kind of like the workbook part of it. Some of it will be workbook kind of like activities. We'll also be doing some very interesting stuff with Image Gently. And if you don't know what Image Gently is, I hope you will. Well, definitely you will by the end of this course. And we're going to be doing some stuff with Image Gently and radiation protection and pediatrics. For those of you that may have already been exposed to that pediatrics learning modules through Image Gently, I will have an alternative assignment for you. So you have these little learning activities throughout the week. Please plan accordingly. They're not going to take a terrible amount of time in, but they are going to reinforce some of the things that you were doing that week or some of the learning objectives for the course. So please do them. I think they are important. I will give you a hint as far as kind of some successful tips for this course. And please review those tips. They are in the course overview in Desire to Learn as well. But one of them is look at your learning activities kind of at the very beginning of the module before you start reading or doing anything. Because you can look at kind of the things that you have to find answers for, and then you begin your reading. And then you might go, oh, there's the answer to that one. Okay, there's the word that I need there. So you can kind of kill two birds with one stone. So my recommendation is read your learning activities first, see what we're looking for in that particular week, and it may kind of may be able to extract the answers as you're actually doing your normal weekly reading. You will have weekly quizzes throughout there. Again, no midterm or final, but there will be weekly quizzes. And that will come primarily from the reading assignments. You might have, it's all fair game, a few questions might be sprinkled in there from learning activities or any other media or assignments that you do throughout the week. So just be aware, I'm not going to make it completely impossible to answer. There'll be kind of bigger conceptual things. But if you are doing a learning activity, I'll say, for example, when we go into the learning activity for Image Gently, and you'll be viewing a series of videos, and those videos then will have certificates of completion at the end, but I actually will extract some basic questions from those videos. So don't put the video on fast forward. If you want to get all your questions right, there will be some basic answers that will come from those videos. So do please watch them. Okay, so weekly quizzes and where you're going to find the answers for your quizzes. I think we've addressed that. Question of the week. That is going to be kind of our discussion assignment for the course. Again, look at the word count requirement. You have to make your main post by Thursday, So make sure you kind of get in that habit. By Thursday, you have to have your main post, and then get your classmate comments in by Sunday. And then let's see, and then lastly, we have the unit papers. There will be 3 unit papers, and these papers will be 3 pages long. You have to have at least 2 pages full, and then something else on a 3rd page. So, at least 3 pages of stuff in the main body. And we will be following an APA style, but not a kind of a traditional APA format. So on the APA, you only need to include the title page for this assignment, the title page, the main body, and a reference page. So when it's all said and done, it can't be more than 5 pages long. So do that, and make sure that you are using your in-text citations in your writing. And I'll put one more ad out for the Writing Center and our Writing Tutor. If any of you have difficulties with writing, if you're not quite getting the grades that you'd like on your writing assignments in this class or other classes, please use the Writing Center. It is one of the student support services that is available to you. Quite frankly, it's one of the support services you pay for. And if you do feel that you need that service, please do use that. I will say that if you're going to use Clay, he's our writing tutor, you do need to contact him soon in the process. He cannot help you if your paper's due in 48 hours and you want him to proofread it. But if you can work out a timetable with him, maybe at the very beginning of an assignment, work out a timetable with him so you know when he needs to see things from you to help you, that's probably the way to work with him. So, and you can find information about the Writing Center in this very syllabus. Okay, so we've gone over the basic assignments. You have your course outline, which basically shows everything when it's due. At the end of the week for those main assignments at Sunday at midnight. So you have all of that information there. And let's see, that should be, forgot almost one of the most interesting things here. Okay, so as you all know, that of course this course started on Wednesday, a little bit unusual start date, and a lot of those due dates will be extended till Tuesday of the following week. So keep that in mind. Also, we have a bunch of holidays that are going to happen during this course. Well, the big one is Thanksgiving. And what we're going to do is we're going to take Thanksgiving week off. So I think that's just the best way to structure this. Some of your other courses may not do it this way, but I think we're paying a little bit on the front end in that we have a very compressed Module 1. But I think by extending the due dates out till Tuesday, we can take care of that. So this way we can enjoy our Thanksgiving. We're going to take that week off, and then we'll come back to finish up the last 2 units of the course. So we'll be coming back on December 2nd. So keep that in mind. And other than that, that concludes this syllabus walkthrough. Again, feel free to look through the entire syllabus, especially the pages towards the end, which include the information for the writing tutor if you need to access that, and some of the other student support services that you can use here at the college. If you have any questions or comments, please contact me through the virtual office or send me an email or give me a phone call. And as always, thank you for watching this syllabus walkthrough, and welcome to Patient Care for Advanced Imaging.